Great smiles require great planning. Hi, I'm Dr. Scott Finley and welcome to my practice. You know, true dental aesthetics are really only a mirror of the relative health of your smile. If there are issues that you're concerned about with your smile, that you're considering making some alterations, there are usually biological or functional reasons why those conditions exist. Teeth that have drifted or moved may be the result of periodontal issues or bite issues that are causing those repositioning of the teeth. Worn teeth can be the result of clenching or grinding or a functional design that's inappropriate. Stains or discolorations can be the result of decay or restorations that exist currently that are in need of attention. Addressing these or any concerns with your smile without first understanding the reasons why those conditions exist can only be wrought in the long term with failure. By placing yourself in the hands of a trained, tenured, and credentialed dentist, you have the best opportunity to not only improving the appearance of the teeth, but the health, function, and longevity of the smile. So the questions often come along, is this right for me? Is it the best thing to do? How long will it take? How much will it cost? Does it require any or little tooth removement or alteration in order for these changes in order to be accomplished? The process starts with a complete exam. And during that complete exam, what we want to hear is what the patient's concerns are, what your concerns are, what are your anticipated goals for the final result. We also begin to collect some data during that time, and that data may include some photographs, some x-rays, some diagnostic models, some computer-assisted occlusal analysis that allow us to truly study the system as a whole so we can begin to marry some of those aesthetic concerns with the reasons why those conditions exist to begin with. The process overall takes 4 steps, and that first step is that data collection and understanding what the concerns are from the patient. From these photographs and from the data that we collect, we can then begin to visualize what are the alterations that we're anticipating with the smile. How are we going to reposition, reshape, or recontour the teeth so that they meet the patient's aesthetic demands or aesthetic needs? This is what we call our 2D treatment planning, our two-dimensional treatment planning that allows us to begin with the end in mind and what the final result will actually be like. The second phase of the treatment planning process is to then begin to implement these changes on a set of diagnostic models that have been mounted on an articulator, which begins to simulate the relationship of how these teeth come together and how they interact. From the stone models on this articulator, we can then begin to make some changes to the surfaces of the teeth out of wax that begin to anticipate these final changes so we can begin to test out this dental blueprint or these changes that we're planning on making to your smile. After a consultation with you, we can then sit down and begin to look at what the concerns are, what the findings were in our data collection, and what our intended solutions can be, and actually have a vision or a view into the future without having ever touched your teeth at this point as far as what the final result will look like. From there, you can make the best decisions based on our recommendations of what the best treatment and the most efficient treatment will be for your smile. Once these issues have been explained and a decision has been made for treatment, we can then begin to move forward in a predictable and an efficient way. Preparations or adjustments to the surfaces of the teeth are made, and once these preparations are completed and additional data gathered, such as impressions, which today are usually accomplished through a scanning or a digital process. So in 80% of the situations, a lot of impressions nowadays are, at least in our practice, are managed with a digital scan. So we begin to eliminate a lot of the putty and the unpleasant experience of having traditional impressions taken. This information then is forwarded to the laboratory, but in the meantime, during the couple of weeks that it takes for the laboratory technician to fabricate the final restorations, we need to be able to provide you with a set of provisional restorations that allow you to smile and have very little impact over your the quality of life during that period of time. But these provisional restorations or temporary restorations that you'll be wearing for the few weeks while the final restorations are being fabricated have a very special purpose. These restorations are actually beginning to approximate what the final restorations will appear like. They are our prototypes. They are the provisionals of what the final restorations will become. And it allows you not only to see what they're like, begin to test drive them. Evaluate them for aesthetics, for function, for phonetics, so we can be that much closer in our final results when the final restorations return from the laboratory. When the restorations do return from the laboratory, which approximately takes about 2 to 3 weeks, you'll then return to the office, we'll remove the provisionals, we'll then try in the final restorations for accuracy and fit. We'll then photograph those restorations and begin to evaluate them together to make sure that they've met our goals and what your final smile will appear like. Once we have decided that this is the appropriate smile for you, the restorations can then be either returned to the lab for final detailing, which maybe happens in about 60% of the cases, or they may be actually applied or adhered to your teeth at that point. This gives us the best opportunity for predictability and durability with your smile. So in the end, the process takes 4 steps. Those 4 steps are, number 1, to begin with our data collection. That data collection allows us to begin to create a 2-dimensional treatment plan. The next step is then diagnostic models. The diagnostic models allow us to test out and develop that true dental blueprint of what the final restorations will actually look like. The third step is the creation of those prototypes in your smile itself. So you have the chance to test drive that experience and make have some input as far as what the final details of what the smile will look like. And certainly the fourth and final step in the process is the return of those final restorations from the laboratory and the incorporation of those restorations in your smile. The key to this entire process is following this protocol in a very deliberate way so that our final results are not only beautiful, but enhance the aesthetics, durability, and function of your smile for the longest term possible. Thank you for your interest in my practice, and we'd be happy to answer any of your questions. My team is a group of tenured and experienced ladies that do an excellent job in understanding the treatment needs that you may need, but also have experienced many of these procedures themselves. Thank you.